Good morning, Chairperson Swordwell and members of the committee. Thank you for the opportunity to appear before you to express our support for Assembly Bill H-22. My name is Shiva Bidar-Sielaff, and I am the Vice President and Chief Diversity Officer for UW Health. My work in healthcare began more than 25 years ago, and during my tenure, I have served in various management positions with patient-facing duties, including as a Spanish interpreter. I have also served as the co-chair of the Latino Health Council of Dane County for over 20 years. I'm aging myself, I know. I'm especially proud of the efforts we have made in recent years to ensure all patients, families, faculty, and staff feel appreciated and respected at UW Health. The diverse workforce at UW Health is representative of nations and cultures from around the world, as well as close to home. The Deferred Action for Childhood Arrivals, DACA program, is one aspect of the diverse workforce and a very important one. We employ many DACA program participants, including within interpreter services, where they play a critical role in assisting limited English proficient patients. This is why I'm appearing before you today to thank the authors of ABH 22. Thank you, Representative Macko, for your leadership, and applaud your efforts to find common ground on an issue that is important on so many fronts. As was mentioned, the federal DACA program was established in 2012 to assist people in the U.S. who were brought here as children but were not citizens. To be eligible, applicants for DACA had to arrive in the U.S. before the age of 16 and have originated from countries recognized by the program, such as Mexico, Guatemala, El Salvador, or Honduras. They also had to undergo an extensive background check and reapply for DACA every 2 years, once approved, if they want to remain in the U.S. It is important to note that DACA program participants pay state and federal taxes, register and serve in the military, are allowed to obtain driver's licenses, are authorized to work in the United States, and have a Social Security card. They make an important sector of the nation's workforce, numbering in the hundreds of thousands, and in Wisconsin, close to 6,000. However, their ability to pursue licensed occupations varies from state to state, as was mentioned, which is why we're pleased that AB H-22 is being considered as an avenue to open more employment opportunities for DACA program recipients in Wisconsin. It would allow a qualified DACA program grantee the right to pursue an occupational license in nursing, teaching, or real estate, among other licensed occupations. The small act of altering the Wisconsin statutes through AB H-22 could mean huge changes in the lives of thousands of DACA program participants. I'm here today to ask for your support for AB H-22 because first and foremost, it is keeping with our commitment to treat with dignity and respect our DACA recipients who have grown up right here in Wisconsin, who have graduated from our local high school, and who deserve access to all of the opportunities that this state has to offer, a state they call home. In addition, this bill is also important to our health system and the overall economy of our state because it will help us in growing our workforce. It is no secret to any of you that we are facing healthcare workforce shortages that have been a major concern for many years, but post-COVID pandemic, it is really at a crisis point. Nurses and other health professions, from surgery technician to ophthalmology assistants, are in high demand, and there simply aren't enough of them. So we're employing a multitude of innovative strategies at UW Health to address this challenge so we can continue to provide remarkable healthcare for all of the people of Wisconsin. One specific effort is our apprenticeship program for nurses, which is one among first in the nation. This program, in partnership with Madison College, is geared towards individuals who would normally have a difficulty in their path in nursing due to lack of opportunities. Our program puts them on the road to becoming registered nurses after 4 years, all while they're being paid to learn. While I'm on the subject of years, it would be wonderful if I came back a year from now and I was able to tell you that our first DACA participant was accepted in our nursing apprenticeship program. It would be even better if I came back with that DACA participant in 5 years and they talk about their new career in nursing, taking care of all of us. That was made possible to AB H22. Please consider the tremendous opportunity before you to make positive change and advance AB H22 from this committee at your earliest convenience. Thank you again for your time and attention, and I'd be happy to take any questions from committee members at this time.